if you're so smart, if you're so intelligent, what else can you do to make a difference in society? What impact can you have? What social things can you change?
Dr. Jonathan Baktari.
You can see it. I mean, it's crystal clear.
I think it's going to really revolutionize things.
Which is a big game changer.
Welcome to another episode of Baktari MD. Hi, I'm Dr. Jonathan Baktari. Today we're going to be talking about something that I'm often asked about, which is, should someone consider leaving medicine if they've been in it for a while? And what are the pros and cons? And what are some of the challenges? And what keeps people from staying in medicine who maybe don't want to, or what makes people leave medicine? And it's a very challenging topic. You know, obviously going into medicine requires a very big commitment, especially to be a doctor. And it requires often, 4 years of college, 4 years of medical school, 2 to 3 or 4 years of residency. Often there's, 2 to 3 years of fellowship. So it's a very long commitment for many, many people. And there comes a time where some people who get into the field may feel like they want to try something else or leave. So what I want to talk today about is, what are the challenges that make some people want to transition out of medicine, out of being a doctor, and what keeps some people in and what forces other people to leave. And we're going to talk about the whole range of things, from just wanting to pursue creative parts of their personality to other doctors who may get burnt out. There's plenty of reasons for wanting to change out of healthcare. So let's talk about that. So most people, after they've invested so much of their time to get into healthcare, feel like they're getting on an express train, which starts, when they're young and pretty much ends when their career's over and they're getting ready to retire. And there's really no stops in between. So most of the colleagues I've spoken to feel like once they've invested so much into their career and growing their career, they really don't have many options. There's several challenges once you become a physician. First of all, like I said, you've invested a lot of time and you've invested a lot of energy and a lot of money. That's a big investment to pay for medical school and college and what have you. The other thing that they have done is, they've built a successful career often where their financial compensation, even if it's not amazing, is certainly by anyone's standard very comfortable. Most physicians find themselves in a situation where they have invested heavily financially and personally and emotionally, and they're making a comfortable living. And the last thing is, even though a lot of doctors would consider themselves very smart, on some level, that's all they know how to do. So if you put those three factors together, you're pretty much handcuffed on some level, because one, you've invested a lot of time, energy, money. Two, you're getting compensated really well. And to then just simply walk away from that is going to be difficult. So those are the challenges. And I think most physicians who are happy and they just continue doing it. But the ones that are unhappy have to also figure out, despite those things, what else can they do? They are not trained to do much else. And so even if they wanted to replace their income, where would they go? How would they do it? So I think the first thing that often you see physicians do is, they try to come up with some sort of other way to create revenue, whether it's investing in real estate or selling vitamins or weight loss programs or some other way to create revenue. But aside from that, it's very, very difficult. And when I talk to physicians who are in that predicament and they want to make a change, they're really stuck.
Hi, this is Dr. Baktari. Sorry to interrupt, but I just want to let you know the reason we created this channel was to bring you really one of a kind inside information on healthcare works, information you're not going to find anywhere else. And we want to continue to bring you this kind of content. So please help us grow. It really helps if you would subscribe, like, and add comments. Add comments about what you're viewing, add comments about what you would like to see in the future, and we'll try to bring that information to you. Again, we really want to be the source where you get information you cannot find anywhere else. Information that you're watching currently on this video, is really rare, and we want to continue to promote and grow it. So we really need your help. Please like, subscribe, and comment. Thank you so much. Be well.
Before I go into some of the ways to kind of get past that, let's talk about some of the more common reasons physicians want to leave medicine if they do. The most common, believe it or not, that I hear the most is I think they realize that there is no second chapter in their career other than just sort of grow in their medical career, which is amazing. But they have other interests. They have some creative juices they want to really work on, and they can't find the outlet in traditional medicine for some people. And so that craving to do something else creative, something that, can allow them to express themselves in ways that just practicing medicine can't, becomes a lure for some people. The other reason, obviously, that we always hear about is simply, the burnout. Some practices, some specialties require long hours, weekends, nights, being on call. When you're younger and you're in residency and fellowship, that might be something that seems sustainable. But for a lot of doctors, that's not really sustainable as they have kids and grow older. And so that lurching to want to have a better lifestyle, if they're in a specialty that doesn't offer that, is a problem. Now, there are specialties, don't want to pick on any of them, but radiology, pathology, things that tend to have better lifestyle seems to be, more sustainable in terms of not causing the degree of burnout. And I think as physicians, give up their own practices and sell their practices and become employees, some of that may be, better because they're not only practicing medicine, but also running a business and some of the HR issues that go with that. So I think those two probably make up the majority of the reasons why physicians consider leaving medicine. So the next thing I want to talk about is what happens when some physicians, most of the physicians I've met who have decided to leave clinical medicine, what their hurdles are next. The most obvious hurdle, like we mentioned earlier, is how do they continue to support themselves, which most physicians were not trained in something else before they became doctors. Many went through the straight road of going from college to medical school to residency, so they don't have a plan B. And I think the other things that I've, again, talking with physicians, is once you become a doctor, besides having a steady income for many physicians, there's something to be said about the status that you get from being a physician. The status of being a physician is maybe taken for granted by some people, but I think for most people who've endured medical school, residency, and fellowship, and actually are in a position where they're helping people and they're making a difference in many people's lives on a daily basis, to simply walk away from that and do something more mundane is a process that's difficult for some people to handle. They just, when you're doing something that is so meaningful and helps so many people on a daily basis, to walk away and do something very pedestrian, and often almost anything compared to medicine sometimes seems pedestrian, is difficult. It's very difficult. And overcoming the lure of money, status, and the satisfaction of helping people to move into something else can present its own set of problems. So I think a lot of physicians get to that point where they say, yes, maybe I'm ready. I'll figure out something else to do. I'll figure out some other way to make money, but they're probably not going to figure out another way to impact so many people's lives in a meaningful way as what they're doing now. That is really a very difficult struggle that I see many of my colleagues who are in that mode go through. The most common response I see to that is many colleagues their answer to that is to have their cake and eat it too, which is they want to see patients part-time while they pursue other opportunities, other ventures, maybe go into administrative medicine, pharmaceutical industry, what have you, but still maintain a clinical practice. And, this is where I often get asked about the value of that. And the problem with that approach is I see a lot of physicians fail because they're really trying to focus on two things simultaneously. If you're leaving clinical medicine to pursue a career in administrative medicine or even completely outside of medicine, you want to become a novelist or whatever, being free to fly to conferences and pursue your next endeavor often requires you not to have these other commitments. And so by definition, you're less likely to be successful at this new venture if at some point you transition from even 50-50 to full-time. Because you can imagine anything in life, if you do it 50% of your time and 50% of your energy, is not more likely to be successful than if you gave it 100% of your time and energy. That's law of just sheer mathematics. 100% of your energy is more likely to make something successful than 50% of your energy. Yet I think that lure and status of, being a physician, being a practicing physician causes people to want to hold on to both. And sometimes it works, but many times wanting to do both really prevents that person from becoming a great novelist or writing a book on even the art of medicine or what have you. So the struggle there is to, at one point, to jump in the deep end and literally jump out of the plane without a parachute and just nothing else. You have to consider, can I get to the point where I stop and I don't have a backup plan, so my next plan has to succeed? And that is very different for physicians. They're rarely put in a position where their next paycheck is questioned. And think about that. That is something that's, I don't want to say very unique to medicine, but it is very unique to medicine, where assuming everything is okay and you're in this field, you, for the rest of your life, never have to question the next paycheck. So the big sacrifice you make from leaving traditional medicine, unless you simply lucked into something else immediately, but if you had to go into another industry where you have to start at the bottom and prove your way and get more education and learn, there's no guarantees you're going to be successful. So giving up your practice, letting your practice go, and literally having no backup plan to support yourself. And then you got many physicians have savings and what have you, but in terms of getting a paycheck, that becomes the challenge. And the ones that I have seen very successful are the ones that at some point, maybe they went through a transition. I know I did that, but they went through a transition where they did both. But when you do both, it works on some level, gives you a taste of it. But often it's when you actually jump in the deep end and have no backup plan that you're more likely to succeed. There's another aspect of this that I want to discuss, which is, can you love what you're doing and yet want to do something else? In other words, I think there's this connotation that people who leave whatever field that they've invested a long time, when a lawyer quits becoming an attorney after, 10, 15 years, there's this connotation that, oh my gosh, they must have been burnt out. They must not have liked it. Is it possible to maybe love clinical medicine, love seeing patients, but still want to do other things? And I think what I hear when I challenge my colleagues who've done that and who tell me they love clinical medicine like I do is the whole concept that just because you like something doesn't mean you want it all the time. The analogy is, your favorite food, whatever it is, chicken wings, whatever your favorite food is, can you eat it every night? And if you stop eating it, doesn't mean you don't like it. And I know that's simplistic, but I think there is something to be said about having a career where you were great at one thing, left it, and became great at another thing, and then maybe another thing. Isn't that the ultimate challenge? Yes, if you go to medical school, do residency, you can be really great in medicine. But can you be great in medicine and then move on and be great at something else or good at something else and enjoy it? So I think that is what I tell people, that even if you love something, it doesn't mean you have to continue doing it. And it doesn't mean if you left something that you didn't like it. It just means it was great, you did it. But what else can you do? What else can you offer? What else can you offer society? How else can you make a difference? If you're so smart, if you're so intelligent, what else can you do to make a difference in society? What impact can you have? What social things can you change? How can you have an impact on medicine from a different angle, from a different route? How can you improve patients' lives from a different perspective by creating another organization or coming up with other ways to impact people's lives? You can say, well, as a physician, I can do it one person at a time, or maybe I can take all my talent and everything I've learned to make an impact at a different level. There is how you can get past this idea that the only way I can make a difference in people's lives is one person at a time. If you then say to yourself, hey, I can be great at something else that also makes an impact on people. Let me give you my angle, now that I've given you the whole perspective, because people often ask me, why I transitioned and how I transitioned from practicing medicine to being a CEO at a healthcare company and starting a healthcare company and growing, what we've done at E7 Health. Part of it was, I think, once you have enough experience and you see the issues more clearly, when you see the issues especially from the patient side, what the shortcomings are in the healthcare industry, and you see the problems and the good points of insurance companies and hospitals and other healthcare providers, when you have that whole perspective, I think the temptation for me was that, hey, I have all of this perspective that's pretty unique. How can I take that information and try to create something that on some level tries to address those things? What can we do to improve patient quality in ways that maybe nobody has thought of? What can we do to improve patient experience in ways that nobody has thought of? And if you want to do that, it becomes difficult to do it just seeing patients. And so I think for me, that was the big lure. How can you transition from helping one patient at a time to helping many, many patients? One of the things that I'm so proud of at E7 Health on our website, we have over 10,000 positive reviews in a span of, I believe, 3 years. And if you read those reviews, it almost sounds like the same person wrote them. And the ability to get 10,000 people to tell you how unique and amazing something you created with the help of a lot of other people, by the way, in the organization, that's gratifying on the same level as helping one patient at a time. When you can create systems, and of course with the help of many others, when you can create systems that are able to impact patients in much broader ways than any one doctor could have, that gives you somewhat similar satisfaction, but maybe even more than seeing one patient at a time. So I think for me, it was understanding that there's risk in leaving traditional medicine, but if you garner all of the knowledge and experience you got from being in traditional medicine and take those forces and those ideas and create something unique, it's almost a crime not to do it. And that only really goes to show you that going into clinical medicine and practicing, gives you the insight that if you hadn't done it, you couldn't have created something like, for example, we did. So I'm so thankful for those experiences, and they're amazing experiences, and I look back at them fondly, of course. But I also know that if it wasn't for those experiences, it would probably be next to impossible to understand how to create something else that changes patient experiences so much. It's something that only someone in the throes of all the issues could sometimes see, where the friction is, where the rub is. I know in one of our other series, we talked about the problems in the US healthcare system, and understanding those problems that helps you come up with solutions. And you can't understand those problems unless you actually were in the midst of it. So in terms of leaving clinical medicine, hopefully one of the positives is if you leave, you also bring with you those thousands and thousands of hours of insight, of epiphanies on, wow, this could be done better, and it could be done more efficiently and with an eye towards quality and patient experience. So that is what helped me make the transition. So thank you for watching. Make sure you like, comment, and subscribe. And if you have any comments, please leave them in the comment section below. And also, I know you like this kind of content. So if you don't mind, if you have any ideas for more content that similar to this or a little bit outside of this, I really love to get extra ideas. So please put those in the comment section below too. As always, be well. Thank you.